Once the patient and the family knows that there's a diagnosis, how do you handle that? It must be terrifying to somebody.
I think hearing a diagnosis is filled with shock and relief. I've had families tell me afterwards that aside from you have Alzheimer's, they heard nothing else. They said, maybe you told us what the treatment was, but we heard nothing.
Except you've got Alzheimer's. So do they deny it? Do they say
I think that it's such a shocking thing. I think it is so shocking to hear those words that it leaves people in a state of what's next.
So what is next? Do you let them settle down and come back a week later, or do you start talking then about, you know, it's there, but we've got lots of things. So how do you talk to that patient?
I think it's important to at least share that, yes, there's hope. I don't believe there's ever a situation without hope. Hope is so important, and I think the attitude is also important, so that if you can find a glimmer of hope and positivity, people do much better, and there's always something to treat. So yes, it's very difficult. Many times spouses in particular are relieved to hear that something is actually wrong, because many times, particularly with mild or early stage disease, no one else sees a problem, and sometimes I see a spouse filled with self-doubt, like maybe I'm making this up. Yeah. Maybe it's just me, maybe I'm the one that is losing my mind.
Yeah, and so so it's a sigh of relief.